For more, let's go now to Dr. Ashish Jha. He's Dean of Brown University School of Public Health and a great person to talk to on a confusing morning like this one. Dr. Jha, good morning to you. Simple question. Based on the publicly available data, does it appear that a third shot is safe, effective, and above all, necessary?
Yeah, good morning. Thanks for having me back. Yeah, based on all the data that I have seen, all the data that's out there, I think people who are vulnerable, people who are older, people with chronic diseases, immunocompromised, they would benefit from a third shot. I think that it is necessary for that group. For young and healthy people, I am far less convinced that we need that third shot.
From a public health messaging point of view, is it potentially counterproductive for the Biden administration to be talking about shot number 3 when tens of millions of Americans are still on shot number 1?
Yeah, it's a tricky thing for the Biden administration because on one hand, they obviously we all want to get unvaccinated people vaccinated because that is by far the most important thing we can be doing. But there are older, vulnerable people in nursing homes and elsewhere who probably need that third shot, and they've got to prepare for that population as well. So it is a tricky message, but we've got to get both of those messages out there.
It's tricky, Dr. Jha. It's frustrating and, dare I say, a little annoying. Is it very common for the science community to disagree?
It is common, actually, Gayle. You know, what's funny is most people don't pay attention to us when we disagree with each other, and it just happens to be in a pandemic. You're seeing it all spill out into the open. But this is science. You know, reasonable people can look at the same data and come to slightly different conclusions, or sometimes very different conclusions.
Well, Dr. Jha, I do have one other question then on the subject of disagreement. There are some epidemiologists and public health experts who believe that the Delta variant is roaring through our country and will leave in its wake a lot of immunity, and that could mean that we're reaching some sort of a peak here where the virus might decline and become more manageable. Do you agree?
Yeah, I do see the South, the Deep South that has seen such a horrible surge over the summer peaking and starting to come down. Unfortunately, there's still many parts of the country with lots of unvaccinated people that have not yet been hit as hard by the Delta variant, and they remain vulnerable. The Midwest, the Great Plains, there are other places. So we've got to keep pushing on vaccinations to prevent more spread of this virus.
And you mentioned the mixed messaging, and we know that causes hesitation when it comes to people getting their vaccines. Where do you say we should go for a trusted source so people can have the right information?
Yeah, so there are people who I also look to for verification of my own views and who I think are really the leading experts. We all know probably the best one of them all is Tony Fauci, who has been a leader in this area for 30 plus years. CDC, Dr. Walensky, I think, has been a terrific public health leader for many, many years. We have very good people in our country that we can turn to for advice and guidance.
Dr. Jha, thank you so much for that valuable information. We'll check in with you a little bit later.